What challenges did island hopping face with wounded? Imagine fighting your way across the Pacific, capturing islands one after another, all while trying to care for soldiers injured in the chaos. That's what island hopping was all about during World War II. The strategy aimed to skip heavily defended Japanese strongholds and focus on key islands that could be used as stepping stones toward Japan. But taking care of wounded soldiers in this kind of campaign was no easy task. It was a real challenge that tested the limits of medical teams and equipment. One big problem was the lack of proper infrastructure on many islands. When troops landed, there were often no airfields or ports ready for evacuations. So, wounded soldiers had to be treated on beaches or makeshift aid stations. These spots were vulnerable to enemy fire and harsh weather, making it dangerous for medics and patients alike. Moving injured personnel from the battlefield to safer locations was a slow process, especially on islands with dense jungles, coral reefs, and rough beaches. These natural obstacles made stretcher bearers' jobs much harder. The tropical climate added more problems. Diseases like malaria and dysentery spread quickly, especially among wounded soldiers who were already weakened. Medical supplies were limited, and hospitals had to be set up quickly in unfamiliar environments. Medical units had to be flexible, moving from island to island, often in hostile territory. They established field hospitals and supply routes that had to be coordinated with ships and aircraft. This was vital because rapid evacuation could mean the difference between life and death. Japanese defenders often caused high casualty rates during landings, which overwhelmed medical facilities. Some islands were isolated, meaning wounded soldiers could be stranded for days or even weeks before they could be evacuated. This increased the risk of death or permanent disability. To help, the military developed special landing craft designed to carry wounded soldiers directly from beaches to ships. Battlefield triage procedures improved, and forward surgical teams were set up to provide immediate care close to the front lines. Air evacuation by seaplanes and later helicopters became essential, reducing the time wounded soldiers spent in danger zones. Overall, the campaign's success depended not only on fighting skills but also on how well medical teams could adapt to these tough conditions. The challenges of caring for wounded soldiers on remote islands showed just how complex and demanding amphibious operations could be. Despite these difficulties, innovations in medical transport and treatment helped save many lives and kept the campaign moving forward.